We're moving on to another section about antihypertensive medications. We'll be covering bosantone, phenolphthalein, nitroprusside, nitroglycerin, hydralazine, minoxidil. So let's kick things off with bosantone. The thing with bosantone is it mainly operates on our lungs. Our lungs are full of different types of vessels. These vessels undergo constriction via endothelin A and B receptors. So this specific medication acts as an antagonist to endothelin A. I'm doing a quick illustration of vessels within this lung model. These sketched vessels are all fitted with endothelin A and B receptors. These receptors are responsible for increasing vascular resistance. Here's a simple analogy. Let's say this is a hand. This hand is the embodiment of endothelin A. It interacts with receptors designed specifically for endothelin A and B. When we administer bosantone, it scrutinizes the hand, effectively blocking endothelin A activity. Now, imagine this is a knife. We can equate this knife with bosantone. This medication is a lifeline for those with pulmonary hypertension. It works by halting the activity of endothelin A. This causes the vessels to dilate. The dilation then results in a marked decrease in the patient's hypertension. In our next section, we'll discuss 3 more drugs. Let's start with hydralazine. Hydralazine works on our blood vessels like a calcium channel blocker. It blocks the transport of calcium in our smooth muscles. Its mechanism is still unknown. It simply relaxes the arterioles and smooth muscles. As a result, it lowers blood pressure. It's administered along with beta blockers and diuretics. That's the way hydralazine is given. Next, we'll discuss nitroprusside and nitroglycerin. This is how nitroprusside works. It causes the release of nitric oxide in our blood vessels, which prevents our blood from clotting. These are drugs that increase the nitric oxide release. They're also referred to as emergency drugs. Imagine if a balloon was a doll, nitric oxide gas is like that balloon. In this way, nitric oxide gas acts. So, this is the best source of nitric oxide. This leads to vasodilation in the vessels. This increases the vessel's width and it reduces resistance. So this is how the drug works. Sodium nitroprusside and nitroglycerin act in a similar way. Similarly, our blood vessels have numerous receptors. Dopaminergic receptors. They're found in our mesenteric, coronary, renal, and cerebral arteries. When phenolphthalein is administered, it triggers activity in the receptors leading to vasodilation. These drugs are used for acute, short-term emergencies. We've examined 4 types of these drugs: phenolphthalein, nitroprusside, hydralazine, and bonestan. Now let's discuss minoxidil. This is how minoxidil operates in our blood vessels. Our blood vessels have multiple channels, such as ATP-activated potassium channels. Minoxidil causes potassium to flow in. Due to minoxidil, vessels dilate, because potassium influx has occurred. Additionally, it has a second function. It's also utilized for hair growth. It's applied directly to the scalp. Thank you very much. Please subscribe.